Welcome to the webinar, Improve Interns' Communication Skills Prior to Orientation. Thank you for joining us. This webinar is going to last about 20 minutes. And if you have any questions, you can put them in the Q&A box. And if I don't get to them by the end of the webinar, then I'll answer them afterwards. The recording will be posted on the DocCom YouTube channel. Well, the match is over, and I hope you're all satisfied with all your incoming interns. Today, I'm going to talk about how one residency program was able to improve the communication skills, the communication scores of their interns. So I'm Barbara Lewis. I'm the managing editor of DocCom since 2014, which was 2 years after my sister spent 2 weeks in the ICU and died very tragically. Everything that went wrong in the ICU had to do with communication. So I'm really honored to work with residency programs, hospitals, medical schools, and PA programs to help clinicians improve their communication skills. So let's get started. We've got a lot to cover in 20 minutes, and I wanted to make this really short because I know you're very busy. Okay, so DocCom is a proven online interactive healthcare communication skills learning system. We were started in 2003 by the Academy of Communication and Healthcare and Drexel University College of Medicine by obtaining a grant from the Arthur Vining Davis Foundation. So we were launched as a pilot in 2005 and the following year debuted as a nonprofit. So there's about over 300 institutions actually that have taken advantage of the DocCom modules and used them for over 100,000 subscribers in over 20 countries. And we've been translated into 3 languages, German, Japanese, and Portuguese. There have been 10 research articles that support DocCom and have taken a look at the modules and reported on studies that they did. And all of this, of course, is listed on our website. So our module authors are leading faculty from around the country. Actually, they're international. We have 42 modules that are interactive and online, and over 400 realistic videos that are unscripted. And we also have annotated interactive videos as well, what I'll get into in just a moment. And we have a back-end learning management system, which you may or not be interested in, but I'm just going to touch on that very briefly. We have a ton of testimonials on our website that you may want to take a look at. So DocCom is actually the flipped classroom concept. The 42 modules are divided into 5 sections: basic modules, essential elements, advanced elements, communicating in specific situations, and communicating with colleagues. So we start off with the basic modules, and we have an overview which has a ton of studies on how communication skills impact outcomes, and another module on mindfulness and reflection, balance and self-care. Then the essential elements, the 8 that are in this section, the 8 modules, they are very closely aligned with HCAHPS, the patient satisfaction survey. So it starts off with the structure and content of the interview, building the relationship, opening the discussion, and ends with providing closure. Advanced elements include some topics such as responding to strong emotions and nonverbal communication. And then we have communicating in specific situations such as the geriatric interview or tobacco intervention, or motivating healthy diet and physical activity, anxiety and panic disorder, and communicating with depressed patients. And finally, we have the modules on communicating with colleagues. And this is, for example, communication on healthcare teams is one example of that module. So all the modules are very consistent in their format. They start with a rationale, then there's patient and clinician videos, then content, references, and of course, lots of videos throughout the modules. So we start off first with the patient talking about why she's made the appointment and why she wants to see her clinician. And then the clinician pops out and he says what he wants to accomplish in this appointment. We have questions for reflection, key principles, learning goals, the content, which is supported by a ton of references. And each year we revise 1/3 of the modules. So by the end of 3 years, all modules have been updated. And that's taking a look at new studies that have been done, adding new references and new material to the modules as well. We have videos embedded throughout, as I mentioned before, over 400 videos. So in all the surveys that we've done, which has been quite a few across a lot of different learners, we find that they really love the videos. And this is because you can watch an annotated video, for example, in 3 different ways. You can watch it and see what the clinician is doing, leaning forward or whatever may be happening. You can listen to what's being said. And now through annotated videos, you can actually read the technique that the clinician is using. And then if you click on the icon with the movie camera, out pops the clinician talking about why he's using this particular technique at this point in the conversation. And in this case, it's assessing conviction about changing behavior. And this is in our module on promoting adherence and health behavior change. So here's one of 6, what we call comprehension scores. And in this case, it's helping learners to understand where an empathic comment should be made. So the clinician and the patient are having a conversation and the clinician makes no empathic comment whatsoever. And what the learner does is listen to the conversation and then click off where an empathic comment should be made during a specific amount of seconds during the video. So there's 6 altogether places where empathic comments should be made. And then the score is here, the correct answers or the incorrect answers. So I've done this several times, and each time I got better at recognizing where an empathic comment should be made. So oftentimes learners at the beginning of their careers think that they don't want to make an empathic comment because it'll open a Pandora's box and lead to tissues and tears. However, research shows, which you probably know, that that's incorrect. The other thing that learners think is that there's going to be a lot more time involved if there's tissues and tears. And actually, it's the opposite. What happens is that in studies have shown that the patient will keep saying the same thing over and over again until that person gets the empathic comment. So it actually takes less time for a clinician to give an empathic comment. Another comprehension score that we have is facial recognition. And in this case, there are 6 different photos that are shown to the learner, and the learner checks off which one of these they are. And the purpose of this is to help learners recognize that micro expression that flashes across the face. So the photos are shown in 5 seconds intervals, and then they're reshuffled and shown in 3-second intervals, and then reshuffled again in 1 second. This is our patient portraits, and these are real-life substance users, one of whom, former substance users, I should say, one of whom was a physician, answering 20 questions on their start, what happened, if they tried to quit and relapse, to help learners understand a little bit more about how people start to use substances. Then we have a checklist, and I have to say, I certainly wish that people in the ICU with my sister had this checklist, because they say that you always remember getting bad news. And these are 17 things to do in preparing the patient or the family for the difficult news that has to be delivered. So let me talk a little bit about the case study of the Greater Baltimore Medical Center, their internal medicine residency program. And this was a webinar that we did several years ago. The Greater Baltimore Medical Center served at that time over 20,000 inpatient cases a year. They handled 52,000 emergency room visits a year with 245 beds and 44 internal medicine residents. So what happened was that in the June orientation, the program director assessed and then had to remediate um, a number of the interns around the EPAs. And while the history and physical was very important, what he noticed is that the quality of them was just not high. And the interns seemed to know what to ask, but not how to ask it. So they would check off the box, ask this question and that question, the next question, but they really didn't know the nuances of engaging the patient and asking a question and then pursuing a follow-up. So he looked around for a solution and he came across DocCom, which has easy access online, anywhere, anytime. And initially what he did is he assigned the modules, a certain number of modules at orientation. And then the following year, he decided to make the assignment after the match in March because he felt that learners have the time to look at the modules and they wanted to impress him. So they wanted to do the modules. And then the following year, when he assigned it after the match, he noticed that there were better communication skills coming in from that cohort. And he was telling me this story and I said, well, let's test it. And he agreed. So what we did is we established a before and after test of DocCom modules. And one of the elements of it was the empathy understanding test, which I just showed to you and mentioned to you. And then the second one was a multiple choice questions, a selected number from the modules that are most closely aligned with the HCAPs, and those are modules 5 through 13. And then we provided the introduction, the directions, and there was no link to DocCom whatsoever in the pre-test. So they did the pre-test, and then afterwards, of the 42 modules, 27 were assigned. And the program director figured that this would be about 2 modules a week between the match in March and the June orientation, and each module is about 1 hour in length. And so he covered all of the basics, the overview, the mindfulness, the therapeutic aspects, balance and self-care, all of the essential elements, and then some of the advanced elements like responding to strong emotion, and it goes without saying, and some of the communicating in specific situations, which was directly tied to the demographics, in this case, a family interview, the geriatric interview, and then also some of the communicating with colleagues as well, for example, communicating on healthcare teams. So what he found was that there were far fewer remediation candidates in the H&P assessment, and there was an improvement in scores too. So in the empathy understanding test before DocCom, the score was 41% of people checking off where an empathic comment should be made. And after DocCom, that score jumped to 96% correct answers. In the multiple choice questions of the modules that were most closely aligned with HCAPs, those were selected multiple choice questions from those modules, the delta between the before and after averaged a 30-something%, but some people scored as high as 75% delta between the two. These two people down here happen to have scored very high in the initial, the before they actually read DocCom. So that's why this delta is so low. So the back end, which you could use, is that you give the assignment, you pick the group that you want, you create the assignment, you have the start date, the end date, and then it shows up on their DocCom. And then you can look at how they're doing. So these are modules 1 through 42 across here, and these are people's names who have been whited out here. So I love this because what you can see is the gradation of the color is how they're doing. So green is at the top and red is at the bottom. So you can easily see that this person has done quite a few. They've done 11 modules. They're not getting that great a score, but they're working on it. And you can see here by module where the scores are not particularly high. In this case, it's shared decision making, so maybe that's something that you want to take a look at. So I think this would be very interesting for residency programs to use this, because this can tell you at a glance before orientation who's doing what and how they're doing. So there's a facilitator guide and an admin guide, and there's also a syllabi that was written for residency programs. So for example, and this is a small group, a 2-hour group, and module 8 is assigned on gathering information. These are the objectives. This is an assignment for the reading. Here are some questions, or reflective questions, or role modeling, or different exercises that can be done. And this is already built in that you can use. So you're probably curious about the cost, and because we're a nonprofit, we're very inexpensive, and in fact have reduced our rates over the years so that we can help more people to learn better communication skills. So it's $30 per seat per year, and this is not per person, this is per seat. So you can rotate learners in and out. So if you purchased, for example, a minimum of 10 seats, then you would have 10 people reviewing the modules, let's say for the first 3 months. Then you can rotate them out and put in another 10 people, and then rotate, etc. So you could do 40, 50 people for $30 per seat, because you're rotating them in and out over the course of a year. So if you have any questions, please put them in the chat or the Q&A box. I'm wrapping up here. So if you'd like more information about DocCom, or you'd like a 30-day trial subscription, and by the way, no credit card is required. We want to help you as much as we can to make sure that your interns, and especially the IMGs, have access to something like this so that they can improve their patient communication skills, which will help outcomes and make the patient have a better experience. So, so I have a question here. How well suited is this program for ESL? So English is a second language. This is particularly well suited. And one of the reasons why Greater Baltimore Medical Center had such success with DocCom is because they have a lot of people where ESL is where English is a second language. And the reason is because DocCom is able to provide the information of looking at a video, for example, and understanding, the interaction between the two, the body language, what's being said, listening to it, but most importantly, reading it. And this is what Greater Baltimore Medical Center said, is that it was the nuances that the ESL residents didn't understand. And so DocCom was really useful for giving them information like this that would help their communication skills. Is there another question or a comment? Or Alan, did that answer your question, or do you have a follow-up? Anything else that you'd like to talk about or ask me about? Again, here is my information. My email is really easy, Barbara Ann Lewis, BAL326@drexel.edu. Thank you very much for everyone who joined us today. The recording and the PowerPoint will be on the DocCom YouTube channel shortly, and please contact me if you'd like a trial subscription to DocCom. No credit card is necessary, and help me in my mission to improve the patient experience by enhancing communication skills of clinicians. Thank you very much.